After any delivery, you can expect to have some vaginal bleeding. Typically, that bleeding will last up to 6 weeks. It's gonna go from a bright red to kind of a pinkish, brownish, and then to a normal yellow discharge. After delivery, you're gonna have bleeding that's more like a medium to heavy period, but you should not be passing any clots larger than about an egg shape. So if you start passing clots or anything like that, we want you to let us know. After that initial heavy bleeding stage, it's gonna go into that lighter type of bleeding and then into that normal discharge. Again, it's normal for it to last up to 6 weeks. Typically it doesn't last that long, but that would be considered normal. The only time we put our patients to sleep is in true emergency situations or if our patient is unable to get comfortable with our normal types of anesthetic methods. Most of our patients receive either a spinal or an epidural type anesthesia for their surgery, and therefore they remain awake. Most of our patients receive a low transverse uterine incision, which will enable them to labor after having their first C-section. There are rare cases in which patients receive a different type of uterine incision, and those patients would be advised not to labor in the future. Permitted you and the baby are well and the baby is full term, you can have skin to skin in the operating room. You're gonna have an incision that you can see, the skin incision, but then you're also gonna have an incision on your uterus. So you in fact do have multiple incisions, not just the one that you can see.